all pregnant women, regardless of their status, should have access to free health care. That's the fight Section 27 has taken up with the South African courts. The organisation has launched a court case in the Gauteng High Court. It's asking the court to find certain regulations and policies unlawful if they don't provide access to free health care services to pregnant women and young children who aren't on medical aid. These include asylum seekers and undocumented persons. For more on this, I'm joined by Sasha Stevenson from Section 27. Sasha, thank you very much for your time. Can you believe that in this day and age we're still having this topic? We're still discussing this?
It's troubling that this continues to be a problem. What we know is, and what is quite clear, is that the National Health Act provides specifically for all pregnant and lactating women and children under the age of 6 who aren't on medical aid to access free healthcare services. And yet what we've seen in Gauteng is legal moves to change that access, to limit access to women who are pregnant and lactating and children under the age of 6 if they are not South Africans or refugees. And this is a violation of their constitutional rights and is not compliant with the National Health Act.
Has the department said anything as a respondent to this court application? Because I remember when Dr. Aaron Motsoaledi was still the health minister, he made it clear that the constitution does provide for South Africa to give care to every pregnant woman who need assistance. So have they responded to your application in court?
We haven't yet received a response from the Department of Health. The time hasn't yet elapsed, so we await that response. And we hope that the response from the Gauteng Department will be to amend the regulations and guidelines that were put in place in 2020 that are now being applied to deny people in the position we've discussed access to healthcare services. So we hope that it won't be necessary to go to court. That's something that we always hope. We have tried to engage before without success, but we trust that having received the court papers, the Gauteng Department of Health will change its approach and make sure that women who are pregnant, who are lactating, and children under the age of 6 are able to access the free healthcare services that are their right under the National Health Act.
Sasha, I'm going to play devil's advocate here, and I don't know if that is the reason really that the Gauteng Health Department, or one of the reasons that they gave to change the regulations back in 2020. But could it be because they feel under pressure because of the lack of staff and the lack of, quality healthcare already, especially in a province like Gauteng that is so overly populated? Could it be the reason why they're trying to see where they can, minimize, the responsibility?
Speculate as to the department's motives, but what we do know is that there is no evidence that there is an excessive or disproportionate number of migrants accessing healthcare services in Gauteng. In fact, the Minister of Health said quite recently that they intend to do a study to determine what the numbers look like and what access to services in the province looks like. So that those numbers are not available, despite the fact that there's often a refrain that health services are burdened by people who aren't from South Africa. There are very clear constitutional and other legal rights here. We have a health system that is under strain for various reasons, but the main reason certainly is not that there are people from outside of South Africa accessing healthcare services. And as I say, the law is quite clear.
And it's always quite sad to see. I remember, later on, the former Minister of Health came out, to clarify what had exactly happened in that case. But I always remember cases like that woman at Park Station, who said at the time that she was refused healthcare, and we found out a little later on that actually she was afforded healthcare. But there are many others, who have ended up losing their children because of the attitude of healthcare workers when they are just asking for some assistance.
Exactly. You're right. There was that well-known case, but there have been many people who have come to us who've had difficulties accessing healthcare services. And until this change in the regulations by Gauteng, we were able to appeal to hospitals to ensure that access. But the problem now is that there are new guidelines, and those guidelines are confusing and internally contradictory, but they are being used and interpreted to deny women and young children access to healthcare services in the province. And so now we have not just an attitudinal problem, but also a legal problem. And that's the problem that we are seeking assistance from the court to relieve.
All right. Thank you very much for speaking to us about this very important topic. Sasha Stevenson, she is from Section 27. All right. Still